Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend, Colin Hung. The world of technology and healthcare, ever-changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news, meshed together in new ways, which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. Today, we'll be discussing the recent Epic UGM and Civitas conferences. And be sure to follow the show on social media at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 17 years of health IT blog content at healthcareittoday.com. So you still jet lagged, Colin? I mean, I know we published this 2 or 3 weeks after the event, but we just got back from both conferences. So
yeah, it was a whirlwind. I'd never been to the Epic campus before. I'd only ever seen pictures and heard the stories from people, and so it was like going to Disney World, Like I was excited.
Did it live up to the hype? Because the pictures seem like it does, but
it is that and more. Like it actually is one of the few places in recent memory that I've been to where it actually exceeds the hype.
Wow.
And in both, and I mean the hype in the sense that people talk about it so much.
They do.
You figure you're going to be in this giant, fantasy land, right? It is that, but also not that. Like it is an office. It's very clearly an office. You're not walking around Disney World, but it's just, yeah. I mean, the thought that was put into the design of that campus, the architecture. I mean, it's phenomenal. I mean, there's nothing more you can say about it. And you could argue whether or not it's warranted. That's a whole different discussion. But what is there? People who are there do find that it helps them be creative and work better. And so, hey, but it's fun. It's a fun place, and the user group itself was something. It was something to behold.
Yeah. Well, I guess you got dizzy from the teacups, not from all the talk about health IT. I mean, Civitas was at the Gaylord in National Harbor, just outside DC. And beautiful. So, it's beautiful right there on the water. So, both of us had posh gigs this week. That's pretty
good. I love that. I love that facility. Actually, the Gaylord in National Harbor is an amazing place to hold a conference.
Yeah, absolutely. Well, you went to the Epic UGM. I went to Civitas. So tell us, what were the big announcements at Epic's UGM this year?
Yeah, there were a number of really big announcements. Probably the one that's the most far-reaching, not necessarily the biggest announcement, but the most far-reaching was Epic unveiled their new partner program, which replaces the old App Orchard and the app marketplace that they had. Of course, they had previously announced that was going to be shut down in December. They then introduced what's called Connection Hub. But then at the user conference recently, they provided a lot more details in terms of the different categories of partners that they will have. So, I'll just outline it very quickly. The top levels, what they call cornerstone partners. That's where companies like InterSystems and Microsoft are. And then there are partners, where there were people like Nuance was there, and then we had another category called PALs, and organizations like Abridge was there, and TalkDesk, and then the level where I think most people will be at is what's called members, and there it's basically any solution that has achieved a level of integration with Epic. So it's, I guess, the most equivalent to what App Orchard was. So that was sort of the big announcement, the one that has the most far-reaching. And then, there were a lot of announcements around, how and where they're going to deploy generative AI and, that they were going to help reduce in-basket clog, by using generative AI to generate responses back to patients with all the questions that are being posed through MyChart. There was some MyChart announcements as well, some announcements around their new CRM system. So a lot of enhancements to the product were the other big announcements.
Yeah, which is always the case at a EHR, user conference. There's always a lot of updates that only the users really care about. So I'm sure there's a lot of those. But the partner one is the interesting one for me. To your point, I think it was a pullback. And it's like you with your kids, right? You're like, sure, you can watch TV, and then they watch 5 hours, and you're like, no, never mind, you can't be trusted. I got to pull it back. You get 1 hour a day, right? Like, that's kind of what it feels like Epic did, was they tried to open up. And from what I hear, they had some partners that kind of weren't good partners, didn't manage the data properly, and kind of damaged some systems, that Epic systems that were implemented at hospitals. And so, now they pulled it back, right? Which, the question is, okay, was that the partner's fault, right? And that you need to choose better partners, which that's what this indicates to me, is Epic says, we're only going to work with certain ones that we trust, right? We're going to watch over this a lot more. Or is that another perspective that I might offer is, hey, that was bad governance on your part in how you worked with partners and how your API worked with them. And so, could there be a better UI and approach when it comes to the API? So, that one is an interesting change, and I wonder if it's going to be kind of this badge of honor. I mean, I know a Bridge, for example, which is one of the PALs that was first announced, and no doubt they're going to use that as as like a little calling card with Epic customers, like, hey, we're Epic approved, which I'm sure Epic would hate them saying, but with salespeople do all sorts of things in meetings. So yeah, that's going to be interesting to watch.
I think so, and I think you're not wrong. I think there was definitely, you could hear in the announcements the way they spoke about these partners, that these were not just partners in name. These were people really truly that were integrated. Their development teams were collaborating closely. They had lots of representation there at the user conference. So this was more than just, hey, getting a badge to stick on your website. So I don't disagree with you that perhaps there was more of a flight to quality in the new program to say, okay, we only want a certain number of partners who are who we can trust and who are going to put in the work, frankly, to make sure that the integrations really truly work the way they said they were. It was interesting that at the time of the announcement at the user conference, there weren't any people that they pre-approved for the members level. Judy did say that it was coming very, very soon, and that the ink was just drying kind of message, but there were only a handful at each category. But it actually was illustrative, right? It was sort of like, okay, I can understand why InterSystems and Microsoft are at the sort of cornerstone level. I understand why a Bridge is and TalkDesk are at the PALS level, and so it kind of gave some structure and to it, rather than lumping everyone in the same space, which is what they used to have. So. Yeah. So that was sort of the biggest announcement there. I mean, the one that was actually, for me, putting my marketing hat on for the moment, there were two things that Judy said that I found really fascinating. And she was basically saying that, when she goes and travels and she bumps into people and then people ask her what she does. I mean, this is obviously people not in healthcare. She's like, oh, I work at Epic, and the blank stare, right? Like, what's Epic?
You mean Epic
but then
Games,
she goes,
the video game developer?
No, exactly. But then she says, oh, we make my chart. All of a sudden the light bulb goes off, right? Because then she goes, basically, we're the my chart company to the rest of the world. Because so many people have now used it. She put up some statistics during her keynote that just shows how many times it was accessed, how many lives are managed through it. And it's an incredible number. Like, it's just a phenomenal number of patient records are available through MyChart. And there were a number of interesting MyChart enhancements that were announced that, as a marketer, I was interested in, because they introduced something called MyChart Builder, which is essentially a website builder, but for MyChart. So now you can more easily skin and lay out MyChart in a more specialized way, in a more customized way, or as the literature put it, in a more personalized way. And so instead of MyChart, which I think today looks pretty much the same, unless someone has invested to build their own, HTML on top of it, they pretty much all look the same. But now with MyChart Builder, you will be able to customize it a lot more and personalize it to your corporate colors and other things like that. So that was actually the most, from a marketer standpoint, a more interesting enhancement that was announced there at the user conference.
Yeah, the other thing I like to do is look at the announcements and say which companies are now out of business, which doesn't happen as much in health IT, right? And they usually have some ground, and there's some battle to happen. But the Epic Gallery was an interesting one with the document management module, right? Like, how many other companies are helping with document management, with scanning in, with managing faxes, et cetera, right? It'll be interesting to see where does that one go? And it's not too hard to see. Could that go into PAX or other areas? It
Yeah.
makes you wonder where's it headed, right? And some of the others like the scheduling, right, and optimization of staff scheduling. There's a lot of companies playing in that staff scheduling, surgeon scheduling space that probably are looking at that, and they probably aren't too worried right now because the first iteration is always bad. But the fact that they're rolling it out, there's a fair number of Epic customers to say, well, if Epic offers it, we're going to use it and we're going to save our money off something else. So yeah, that's the other area that's always fun to look at and say, well, who else are they gonna kind of ruin if because they roll out the feature?
Absolutely. And you're right. I mean, those were the two that I would have picked to say, oh, that's interesting that they're getting into that space, especially around gallery, which was the one around document management. They basically said it wasn't for imaging today, but clearly it could have gone, it could go there very quickly. And then also, yeah, there was a lot of talk about scheduling, but the way they couched it was, not necessarily all about the schedule, but more about the optimization of the resource or the schedule was for. So they were talking more about scheduling for like OR, CT, like the high dollar value places. And what they were talking about was using their massive database and all the data behind it to go, are you optimizing not just the schedule for the surgeons, but the schedule of the resource,
for the equipment,
right? So,
yep.
Hey, if you're going to schedule this OR, turns out like the half the resources you need aren't available. So you really shouldn't schedule it there. And maybe this is a better time for you. So they were talking about it like that, which, as Epic, they would have visibility into all of this, which, may or may not be available to other folks who make scheduling software. So, but yeah, those two are interesting. The one thing, John, I have to say is there was a couple of things that I found interesting that weren't talked about at the UGM.
Okay.
One, they had with Microsoft CEO there, Satya Nadella. I thought there was going to be a lot more discussion around nuance and like AI and how Microsoft was doing a lot of things. And
yeah, DAX.
I gotta give him kudos. They did not take the opportunity to be promotional. They were on stage, but they just really talked about AI in general. And they left it up to the press releases and things to come out to talk about their deeper integration, the deeper level of collaboration between these two companies. I thought that would be much more front and center, in the event.
Well, and to your point, Microsoft is a cornerstone partner. Nuance is a partner. So 2 of the 6 companies that are announced as partner are actually Microsoft, which
right.
I guess makes sense why the CEO would go there to be part of it. But yeah, you're right. But I actually think it's probably wise on Epic's part because the Nuance DAX Express solution isn't fully baked, right? So I don't think they're ready to demo it because it's still being,
True enough.
piloted and stuff like that. So I think it's like, hey, this is hopeful. And, you got all the conversational AI, generative AI, got a few of those things in there. So they didn't look like they were being left behind. But, a lot of the stuff that that we hope we get to, like the full ambient clinical notes that are automated with humans, not scribes, it's still under development. So I think that's probably why you didn't get it. The one that I didn't see, at least from the reporting that I saw, because I was obviously wasn't there, but from your report and others that I saw, I was surprised we didn't see more data and especially data partnerships. Because before they talked about the payers and things like that, and the work they were going to do with payers to accelerate things like prior auth and how do we help provider organizations with prior auth. And I didn't see a lot of that, like it seemed like it was more focused on the providers and what can we do? And hey, we know you're burnt out. How can we change the UI and some of those things? So that's what I was surprised we didn't hear more life sciences, pharma, payer type of opportunities that Epic certainly has if they want. And maybe they're working on the back end. They don't want to talk about it on the front end. I don't know. But I was a little surprised there wasn't more conversation there.
Yeah, you're right. It was a little bit about that, but not too much. Hey, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hung. Today, we're talking about the Epic UGM and the Civitas conferences that John and I both attended recently. Today's episode is brought to you by Sway Health, our new sister publication that is focused on news and stories in the world of healthcare marketing and patient experience. We just announced our very first Sway Health event in Toronto, head on over to sway, that's with 2 A's, .health for the details. And I hope to see you there.
Awesome.
So John, let's talk about the conference that you went to, the Civitas conference. So let me ask you this: being there and being in the middle of it, are TEFCA and QHINs real, or are they going to be memorex?
I love the memorex reference. Is it real or is it memorex for those that are young? Go search it on YouTube, right? But it was interesting, right? Civitas is such a unique event, and it's certainly known for the HIEs because of the chic portion. But what was interesting was the evolution to include many community organizations, which I think had always been part of it, but the HIEs were just so visible that you often didn't realize that, oh, by the way, Civitas was emerging of like 3 organizations, and some of those were more of the community health, things like SDOH related type topics. And we even saw, a HIE merge with a community health in San Diego to bring the health information and the community services together, which is an interesting evolution. But those things aside, everyone was, of course, talking about TEFCA and QHINs. And what does that mean for these HIEs and for these community health organizations? And does it make them obsolete? Does it do anything? And what was interesting is there were kind of 2 things that were happening. On the high level, everyone was saying, yeah, we'll be friendly with QHINs, right? And I look at it and I say, well, why wouldn't they? But then you look at it, and they're like, but QHINs don't solve the problems that we solve. Like it does a quarter of what we do. So basically the HIEs weren't really nervous about it because they realize that they do so much more than what the QHINs do, and often at much better levels than what the QHIN's going to do, at least initially. And so, the above ground, they're like, sure, we'll work with the QHINs. And there's some question, because I guess you have to choose one QHIN as your master QHIN. And some of these are like, well, we work with 2 or 3. Like, okay, we got to decide which one. What does that mean, right? So there was some of that discussion, right? But for the most part, the HIEs were saying, sure, bring the QHINs along. Let's see what happens. I had one say they're going to destroy themselves. That was interesting. So I guess they thought it wasn't real. It was memorex and it's going to be gone. But, others were like, yeah, it's just another piece. I loved what Catherine from Direct Trust said. She's like, we're all part of Team Interop. So it's okay. It's just another methodology, another way to communicate, and we can all play together and solve different issues. So I think that's where we are. There's a lot of wait and see. It's taken a long time for these QHINs and TEFCA to come into force. And they're like, okay, let's see how they play out. But most of them are not worried because they know they do so much more than the QHINs are going to do.
I was going to say, so do they see QHINs as a threat, or is it more that that's what an evolution towards where they might be going?
I would say they actually see it as backwards.
Oh, okay.
They actually think that they're so far ahead that they're like, well, what's the QHIN going to do? And it does have a national presence, which is different than many of the organizations that are very regionally focused, or, in general, most of them hit the region. So, I think when you look at it in that regard, that would be the difference, is the national focus maybe. But other than that, they look at it and like, well, we're kind of already doing that. So what are you really offering that is so different? And it's a really good question, right? But I think the answer is that national network.
Interesting. I mean, I gotta be honest, like QHINs, I think everyone is taking a wait and see approach, right? I mean, it wasn't even a topic of discussion at Epic, and Epic itself is now a QHIN. And so your comment around everyone's sort of waiting and seeing how this formulates or how it solidifies is interesting, because I think that's where a lot of people are at least mentally with it. That's certainly where I am with it. But to your other point though, everyone's not saying, oh, it's going to be gone. I think people are saying, look, it is real. It's here. We have to deal with it, learn from it, or use it. And yeah, I guess to Catherine's point, it's just another way for people to share our data, which is what we're all really trying to achieve, I guess.
Yeah, and there's a lot of skepticism, especially the undercurrent at the event was, what is QHIN really accomplishing, right? Like, and what is TEFCA? And it was also interesting. I did some video interviews that will be coming out shortly. And, I asked a bunch of them the question, what do you think of TEFCA and QHINs? And one of them was like, hey, I came to the conference to learn about it, and here's what I learned. But the answer was essentially, we're still figuring it out. Like they don't even know. They're in the middle of interop, they know it, and even they don't understand it fully and how it's going to play out. Because I think some of it is still TBD, right? And when there's a lot of discussion, it's sharing these summary documents, right? Well, it's not using fire, but eventually it's going to. And when is that going to happen? And how is that going to happen? And and so there's a bunch of things like that that are all unknown or still to be determined how they're going to be implemented, that a lot of people are like, well, let's just see what they accomplish.
Now, you said, of course, one of the benefits of being at this conference, and you've gone for a number of years, is just to see the evolution of the health information exchanges and the evolution of the services they offer. You mentioned the one that merged with the community organization and actually is providing actual health services now. That's a very interesting evolution. But you mentioned a term that I didn't fully understand until you explained it. But you said health data utility.
Yeah.
What is that, John?
HDUs is the new acronym, I think, that you'll hear if you're hanging out with the HIE folks. And really, it's an evolution when you think about health information exchange. It was given all the funding from the government. There was a bunch of funding that was given to a bunch of different states. A lot of people think a lot of them squandered it, like, to be fair. And then there's some that either didn't take funding, they just built it on their own and understood the business case. I met an interesting company that came from that, that was like, hey, I figured out the business case and then I built it, right? Rather than I took a bunch of money from the government and what are we going to do with it? So that was an interesting, it's interesting the fiefdoms and the approaches that each state took. But what's unique about the health data utility and why everyone that I saw that has an HIE or something that's similar to an HIE, why they've adopted the health data utility is, I think, actually for a political reason. So it's like, how do they describe themselves to the political organization in their state, which most of these are state by state, and it's funded by state, whether it's Medicaid, whether it's, state grants, whether it's other things like that. The state is governing a lot of the funding for it. And when you think of it as a utility, you're like, oh, okay. So then that would mean some government oversight, right? It means you are a monopoly, but that's why you need the government oversight. It also means maybe some government funding, because this is a utility that's useful to the citizens of that state. And so when you start talking about it as a utility, it helps you, I think, articulate to the political people, what is important about this health information exchange, or this, as it expands to social services, et cetera. It's a utility that helps share the health data to improve the lives of your citizens. Now, that's something government can fund, whereas before they'd go, hey, well, we should exchange health information. And they're like, you're not already doing that? Or, like, why would we fund that? But then as a utility, you're like, oh, this is a utility that's useful to the citizens. Maybe I'll fund that.
Well, and after you explained it, and thank you for that, by the way, I'm sure our audience was like, it's like chewing that over right now, but HIEs have gone beyond just simple exchange of information, right? They're doing things with the data that they've collected, right? And so being a utility, I think that term allows you to do that. Like, it's more expansive than just an exchange.
Right.
So I think it's an interesting term, and for the political side that you just mentioned, I can totally see that it would play better, right? And it's easier conceptually to understand what that is, right? Exchange,
and the value.
Exchange, you immediately think of stock exchange or something like that, and it's like, it's not quite the right analogy, or like a marketplace, right? Like it.
Sure.
I from a marketer standpoint, the utility is a little bit more concrete, and I can see why the state governments might want to take more of an interest in funding something like that.
Yeah, and it was interesting in one of the unconference sessions, someone asked the question about, like, well, how do I present this to my political leaders to garner support for it, right? Like, the health data utility, that could solve almost any problem, right? Like any health data problem, including Medicaid, including foster kids, including, schooling, including, the costs for, healthcare for employers, right? Like you get this expansive list. Well, utility could solve all sorts of things. And they said, how do I do that? We can solve all these things. How do I present it to the politician? And Angie Bass from Velatura gave a great response. She's like, well, you need to go to the politician and figure out what they care about. If they care about foster children, then guess what? Your health data utility helps to solve for foster children. If your politician cares about Medicaid and efficiency of Medicaid and all that, well, then your health data utility solves Medicaid, right? Because you have to, for lack of a better term, pander to what they want to accomplish, right? It is politics after all. So it was really interesting to see this kind of overlap between the political sphere and the healthcare sphere, because so many of them wanted to get funding and need to get funding from the political organizations. Of course, in Nevada, it's all privately done, but he would love to have some political oversight and some political access to support what they're doing. Because then, what's interesting is getting participation is harder. In some states that are Medicaid said, well, if you want Medicaid, you got to participate in the HIE. Well, guess what? They all participate in the HIE, or I guess the health data utility now. And so, there's some pros and cons each side.
No, I like it. So we're basically, John, what I'm hearing is we need to produce a t-shirt, QHIN ? Or HDU ? Right? It's sort of like
I think it's clear who's a QHIN.
Who's on team QHIN versus team HDU. That'll be fun to see. But no, I really do think it's a much better term. And let's be honest, I mean, just hearing that these organizations are continuing to evolve gives me a lot of hope, right? They're not just sort of sitting still and just kind of, spinning their wheels. Like it sounds like a lot of them are trying to find ways to be valuable to their state, to their constituents, and finding new funding sources in some cases. So, good for them for not sitting on their laurels.
Yeah. The other thing we're seeing in that community is the consolidation, and it's happening in a big way. Where it doesn't make sense to, you're providing the same services regardless of state. Sure, there's some political differences and some interest, by the different healthcare organizations or public health organizations, et cetera. But fundamentally what they're doing is the same. And so we see a consolidation happen. We've seen it across multiple state lines, and I think we'll see it even more, where now these big organizations that are in multi-states will combine together and kind of join forces in this effort, which I think is probably going to be a good thing.
And on that note, we come to the end of another episode. Thanks to all of you who tuned into this episode of Healthcare IT Today. You can find more details about our show by checking out the programs page at healthcarenowradio.com. And please share your voice and engage with the community at healthcareittoday.com and on social media using the hashtag HITSM. I'm Colin Hung, along with my friend and health IT collaborator, John Lynn. Thanks for listening, and have a great week.